Hello, I'm Stephen Davis. I'm the co-chair of the Melbourne Mobile Stroke Unit with my friend and colleague Professor Jeffrey Donnan. The Melbourne Mobile Stroke Unit is at a very, very exciting stage of development. We've been operating now for 4 months, and as you know, the concept of the MSU is to take the emergency department directly to the patient's home. We can do the brain imaging with CT to determine whether or not the patient's had a stroke and which type, and we can look at the brain arteries to see if there's a blockage that might make the patient a potential candidate for clot retrieval, what we call endovascular thrombectomy, a very exciting development in stroke. So we've been operating now for just on 4 months, and we receive 6 to 10 calls every day to treat patients with stroke or potential stroke. We've treated over 20 patients with TPA, clot busting treatment, at their homes, and we know that this much earlier treatment will result in better outcomes. Even more exciting, we've using CT angiography, where we get a picture of the arteries in the MSU, we've been able to treat 18 patients in the hospital very early on now after arrival with blocked arteries that were diagnosed in the MSU. And we know that this unblocking of arteries with thrombectomy on top of intravenous clot busting treatment dramatically improves outcomes. Furthermore, the Melbourne MSU is a wonderful research platform, and this distinguishes us, I think, from most of the other units around the world. So the initial research trials that we're doing in the ambulance involve, firstly, the world first trial of tranexamic acid, which is a drug to stop the bleeding after brain hemorrhage. Brain hemorrhage is about 15% of strokes, and we're enrolling patients actively in this trial, and we plan to recruit other centres in Australia and overseas. We don't have a good treatment for cerebral hemorrhage, and we think that this will change the paradigm. We're also doing a trial of clot busting treatment using a different drug called tenecteplase before thrombectomy, and we're giving this different thrombolytic at 2 different doses in the ambulance. Finally, in another world first, led by my colleague Henry Zhao, we've been able to treat a number of patients who have been on the drug dabigatran, an anticoagulant used for atrial fibrillation, who've had a stroke, and we've been able to reverse that drug in the MSU with an agent called idarosizumab or Praxbind. We've been able to reverse the anticoagulant, then give the clot busting treatment, and in 2 of the 3 cases they've gone on to thrombectomy. So after 4 months, a lot's been achieved, but I think a lot of excitement ahead. The most important thing, I think, for our patients and our community is that this is a radical shift in stroke treatment into the pre-hospital arena, and starting treatment as early as possible, because we know that after stroke, every minute counts. Thank you.